So I said, what if we could get an
Okay, hang
hour?
on. It's going to be recording in a second here. Hang on.
Oh, I want to tell you this before I record.
Well, I already got it on YouTube Live and it's just loading up there, so I can't stop it.
All right. Okay. All right.
So yeah, tell me about it in a couple minutes. All right, here we are again on Upstream Intelligence. And today we're going to be taxing poor Victoria and showing for her to kind of do a little bit more training on her software called DrLinxs. So go ahead and introduce yourself, Victoria, while I do a couple of more clicks over here.
Sure. My name is Victoria DaCosta, and we are collaborating and teaching how DrLinxs, linking the doctors' collaboration information and their provider skills into a software that I designed for communicating cases that overlap, what we call shared domain. And I'm a dental hygienist by trade, and I came up with an idea that as I was in the mouth, I saw a lot of medical conditions and they were going unnoticed and untreated until the person was symptomatic in the body where you had a condition that was more advanced that could have been treated earlier. So what I see in the dental hygiene field is an opportunity for us to be able to work in collaboration using our knowledge and our skills to discuss early indicator findings with medical doctors, with chiropractors, with naturopath doctors, doctors of osteomedicine, functional medicine, any kind of provider, even well care providers that are neuromuscular release tension providers. I have seen people clamoring for a team to help them heal. And so DrLinxs is that link in the software to help communication and show where the damages are in the nervous system. The nervous system is bar none, like Dr. Fonder, A.C. Fonder discusses in his book, the area inside the mouth is going to showcase us areas of neurological damage way before the medical sees it. And we can record it and report it and discuss it. So that's what we're doing today. We're learning about it and we're going to discuss it because so many dental hygienists, as Shirley knows, we are told not to discuss it. And that's why we're upstream, because we are in the mode of discussing and also educating, which is a very important part. And I know, Shirley, once our podcasts get in a mainstream social media, this is going to take off viral because how many dental hygienists see medical environment conditions and don't know where to go or how to report it? And a dentist might be treating an area in the mouth and not understand the neurological damage that they're including, that they're causing, and because they're not collaborating. Or they could reverse the medical by collaboration because of their skills and the skills of the provider that they collaborate with, such as a chiropractor or a nutritionist. So I see this potential of collaboration as a huge void that you and I are in the process of creating a bridge and closing that gap.
People don't know how to, or professionals don't know how to collaborate. They can barely collaborate within their own silo. Really, we intended for Upstream Intelligence to be a podcast for all kinds of providers. And we're just focusing on dental hygienists right now because obviously that's our silo. But we understand that we need to communicate with other people. The communication between the dental hygienist and the dentist in the same office is very poor.
Very
So,
poor.
and I think that's what you were just trying to get at. So, it just brings to mind a story that I think I may have already shared here was I was talking to a patient about the new science that the mouth is connected to the body, and we have labs now that we can prove it, and we see so many of this and so many of that. And the doctor called me into his office onto my bare spot on the rug. And he was like, we just don't have enough information right now to even talk about that. So I was confident. I like being confident on the bleeding edge of science. I'm right there all the time. And he wasn't. He was very good at doing cosmetic dentistry, and he knew how to match up the colors and blah, 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 and all of that. He was good on his thing. And I could at least tell patients, Dr. So-and-so is very good at cosmetic dentistry, la, la. But he doesn't trust me to be on the front of this. So it's just bad all around. And with this tool, with this DrLinxs tool, you've been only yammering about it to me for what, 10 years or 15? And I was like, yeah, sure, sounds great. And so now that I've been monkeying around with it, because I have all of the tools now, because I went and I got, this is the FLIR camera, right? And so I'm excited about learning better how to use the technology. And I bumped into a couple of problems this week as I was taking a bunch of pictures. I wouldn't call them problems, I would call them questions. And you've started to kind of tell me about some of the answers. I am not a clinical dental hygienist. I'm a myofunctional therapist, and I work with a chiropractor we share a little reception room here. And so she comes in and she takes the camera and she takes a couple shots, and then I put it through the system. And so in our last episode, I put somebody up there to go, oh, that's C1. And I was like, okay. And then she came in after, maybe it was even the same day or the following Monday, and she goes, oh, it's C1. And I was like, how did you see that? And so, it's a communication tool, like you said. It's exactly what you've been talking about. And in my myofunctional therapy practice, I'm finding it to be pretty useful and pretty helpful past just the photographs. So I'm going to share my screen, and then we're going to start going through some of the stuff here. Oh, that's not a good look at all. Oopie.
Well, one thing that I love about infrared is it's not judgmental.
Right.
What you see is what you get. It's a glass house. And it's not only the nerve damage alone. The nerve damage, the nerves are ignited and fired because of thought and emotions. It's very fascinating when you start understanding how emotions play a part.
It's a whole nother layer.
Well, the nerves are a response to the emotions. The emotions are the thought. So someone in an accident could find out that they see the car coming towards them and are frozen because of their sympathetic. And they capture that nerve is damaged with that emotion, and it's actually exacerbated and trapped in that tissue for years to come. And so a lot of these areas where chiropractors and doctors have a hard time releasing that area of pain is because there's an emotional aspect to it associated with that pain, bar none. And it's very fascinating how infrared discovers and uncovers all of these layers. Like you talked about, they are layers. But using the software, you'll be able to do this. You'll be able
to. In dentistry, I think, and that's what I was trapped with for a long time. I'm like, it's muscle temperature is how I was anticipating reading the thermography. Because right when you say thermo, it says temperature. So when you were saying about the nerves and stress and tension on the nerves, and now you're saying that there's an emotional, what you call it, on there. And so so you have to shift from what you see is what you get to this is reading temperature to this is reading neurological signals from the cranial nerves.
Let me clarify.
Yeah.
When you have a hot wire in the wall, what could that do to the building eventually?
Oh yeah, it'll burn it down.
Okay, so what the nerves are hot. They're heated. They're overstressed with too much
That's
electricity.
great.
That's why you have the heat.
Yes.
The muscle is cold unless it has the nerve running through it to give it the charge and the movement. So that's why it's neurological. Is the bottom is the first layer of light.
Yeah.
And Dr. Fonder talked about that in embryo. The neurological part of the teeth are forming first before the neural crest, which is the fluid. If the teeth are forming first in the neurology part, that's a communication right there
Should
that
tell
tells
you
you
it's like the most important, right?
that's why you see skulls
So the
2,000
heart is
years
number
old with the
one, and
teeth
then
in them.
comes the teeth, right?
Yeah, the teeth are the communicators. They're not the cause, they're the communicators. They're the messengers. Just like your
So,
eye whites, when your eye whites are yellow, it doesn't mean they're chemically altered. It means the nerve damage in the liver is not filtering. It's blocking up the lymphatic system, and the lymphatics is toxicity. So that's why you say your eye whites are yellow, that you've got liver. What do your eyes have to do with liver? It's a
yeah,
location. So it's the connections of the neurology in the body is what Dr. Funder is really, and that's why I encourage everybody to get his paperback book for $25 and really use it as your Bible.
yeah.
And that's what I did.
Fonder.
Fonder. Yes. Okay. So
Sweet.
what do we have here,
All
Shirley?
right.
Just to
So now
clarify.
I'm in the beginning page. And so I added a new patient and I went through all the steps and I kind of blinded the patients a little bit so that we could use them. And this lady in particular was interested in prevention. She has a tooth dying on the upper right, and that was the most thing. And then she says there's no other symptoms for that dead tooth. And I don't even know, I didn't talk with her a lot. It was a chiropractic patient. And the
Uh-huh.
chiropractor was like, oh, you do have symptoms. It's causing tingling in your head. And I was like, okay, that's nice to know. So then I saved it. And then I clicked on this right here. And then I went to save. And then it brought me up to this next thing here. And then I went to the screening tab, which you showed me last week. And then I was curious about this token. So I can get a token for this page and share this link with the patient so that they can see what I can see. Is that right?
And the only thing that they see are the questions to answer.
Oh, I see. Okay. So it's not like something I could share with the chiropractor and say, here's her pictures.
Not with this link. On the visual,
Okay.
yes, but not
All
on the
right.
verbal.
Okay. So I didn't do a lot with the verbal because I just barely met her. We're seeing her daughter. So,
And there has to be an agreement, a permission by the patient that you can share that information in that page where it says, I agree.
yes,
It has
we
to be
went,
clicked in order to generate a provider link.
okay. And I think I did click it, right? I mean, it's not here
It's
anymore.
not
Oh, it's
highlighted.
this one right here.
Uh-huh.
Okay.
And then you got to
And
save
then
it.
save.
Yeah.
Always got to save.
Well,
All right.
we'll
Oh,
have
there
it.
we go. So
Yeah.
that's the provider link. Is
It'll
that
say
right?
provider. That says patient.
That says patient provider. So I could generate this and then share that with
And then you just
Dr.
little
Samuel.
clipboard right there, the clipboard
Yeah.
next to it. Yeah, copied. And
then she has until June 24th to get that,
yes,
to
it
use it.
expired, right. Mhm.
All right. So then the tooth is on this side.
Now, do you
So
want to contrast the image we were talking
yes.
about?
So let's first do the wrong way or the less effective way,
Okay,
because that's where
the
we
less
left
quick
off
way.
yesterday or last week.
Okay.
Right. So we had this image here, and then you said to overlay this image on top of it using
What do you want
this.
to look for specifically here?
Yes. So I want to know what's going on with that tooth.
Oh, okay. All right. Well, I would
So,
look at a lateral shot and a dental x-ray.
well, I don't have a dental x-ray.
See, a dental x-ray is going to give you hard tissue circulation.
Yeah. And it's not going to be very effective. So what I plan on doing is get this ready for the dentist. So when she goes to the dentist,
Uh-huh.
she'll have this image. The dentist will take the x-ray, and then the dentist has, 80% more information than they did in the first
Oh,
place.
they have the soft tissue, yeah, that you didn't have before,
Yeah.
right?
So then I lined this all up and I was like, okay, so we can see here that it's a little bit warmer and it's going up and down. And then I was like, yeah, that's not the right image. Let's do the side one where she is complaining of a problem. And so I was getting good at moving this around.
Sometimes a tooth is a referral. It's not necessarily the
Right.
tooth. It's
Well,
the
the
nerve.
tooth was measured to be dead.
Yeah, but the nerve coming into the tooth has a source.
Okay.
So you can actually reverse that by treating the root cause. The
Right.
root cause is
That's what we're
probably
looking
coming
for.
from a malfunction in the TMJ. So that's where you look, you follow the pathway, the neurological pathway using infrared to see where's the cause of the.
So this image is not very helpful. And then you said, why don't we go and learn about contrast
Well,
and
I
how to
would say
change the
you still
contrast?
can use it, but you're in biochemical right now. You're
Mhm.
not even in neurological viewing. To the far left, you've got to bring it down and get even go down to the nervous system. Okay. And so now what I would do is up the game on the heat to the right and temperature. And then what tooth was she talking about?
This bright one, this white one
Okay,
right
so
here. So
so
tooth
then
number
I would
2.
bring it all down, bring the heat down to the very bottom, keep going until it disappears, and now click on that nerve, the one that
This
she
one,
complained. Yeah, click on it and see which one it is.
I am clicking on it. So it's not clicking.
It normally would, so
Yeah. And I did run into that.
there it is.
So
Trigeminal. Okay, so what she's doing in her panorex, I would see that her panorex is that she's bone on bone in her rotation. So the trigeminal nerve is highly stressed and damaged. The reason the tooth is dead is because it's not getting any information from the brain. And the brain's not, and she
I
can't.
see what you're saying, because tooth number 2 is hard to damage unless there's a gigantic filling in there. She does have a filling in the tooth, but you're saying that her jaw joint is probably affecting the trigeminal nerve.
I want to go back even further, Shirley. Why did the
Okay.
tooth get filled?
Well, yeah.
Nerve damage. Any kind of filling, any kind of crack, any kind of change in that environmental is a nerve damage. So she had nerve damage years ago. Did she get hit in the head? Did she fall off? Was she in an accident? We don't know. That changed the skull's circulation of the skull information, and the body went into sympathetic mode and started to protect itself by constricting. When it constricts that neurology into the body, it's going to go into the teeth, a bar none. And that's why the tooth and organ connection is always discussed. She could have also been punched in the gut, and the relationship in the neurology goes right back into the brain area and loops in from the vagal nerve. The vagal nerve branches off the trigeminal. Do people know that? The vagus nerve goes into the heart muscle, the lungs, the liver, the kidney, the pancreas, and the reproductive organs and the glands. So that's where you got to trace this pathway back. And I think dental hygienists are going to be so brilliant at this fact finding, because the symptom is the tooth. The cause is not the tooth. The symptom is now we've got the trigeminal nerve acting up, and it's highly stressed and it's damaged. You can see it on the infrared. Now you gather more information about the verbal. Yeah, I was hit in the head as a bat when I was 10 years old. A baseball bat? Yeah, I was hit on the right side. Oh, well, okay. Well, there you go. Now you're getting somewhere with the life damage events over time. And this is what when we had Dr. Paul talk about neurological damages in the body that he sees and he releases right below the submandibular in the area or not something the suboccipital lobe. It's fascinating because people are chasing symptoms in the dental world and they're not collaborating with the providers to say take the pressure off the C1 atlas. I would say her C1 atlas is the one of the areas contributing factor to compressing her vagal nerve. But there's something in the trigeminal nerve that's not getting enough signal. And so the wire in the wall is heating up.
And we
And
can see here too that it is heating. It goes
there you
white
go.
down
Yeah.
here.
Yeah.
So that was something. So, okay. So now we've
And
got
then
some
look at the
starting
brain tissue
points.
too. I would say even do some more investigation with the neurology in the brain tissue. Um,
Okay.
and look at to the left and just bring the brain tissue into it a little more to the left and you know start to just really put those pieces of puzzles together with her to fact find where that nerve damage is root is coming from. And she's locked up in the neck and she's got a lot of compression, and that compression is contributing to her pain. And then
Okay.
take a picture of it, yeah, for your
Yep.
chiropractor screenshot. I love it. I'm
All right. So now we've got that. So
uh-huh.
now you're saying that we can get even better information if we mess around with the contrast. And
Yeah,
so
you've got good
let's,
information there, but yes,
yeah.
if you want to get some contrast with some black background on the image, yes.
And now tell me where that was to
In the
mess with the,
library. So now you're in the thermogram. So you go down below the images where it says library.
okay. Oh, here. Oh,
Uh-huh.
right. Okay. So that's where I dumped all of her pictures.
Yeah. So
And
then you
so
go down to the
then,
FLIR library. I
and
think
those
you have an
pictures are going
account
to be
set
in the
up. Yeah.
FLIR.
Yeah, you're gonna need an account. Yeah, do you have an account set up? That's a
No.
free account. So what you'll need to do is set up a free account. And you can do that very simply. They just, like any free app, they have you put your information in there.
Okay.
The reason FLIR the camera is connected with FLIR software, the FLIR camera, obviously FLIR software. And DrLinxs can house the images through the FLIR software, and you just drag and drop them once you get your contrast. So it's just an extra step to get the view, but you still got the information even without the contrast. And I'm teaching the dental practices to skip the Dr. FLIR software for now when they just want to show a patient the areas that are heated or stressed, the nerve damage areas, with the chart, like I showed you with the head and neck circulation. We should go back to that because I think that is going to be phenomenal information when you're stressed for time in that hour. Taking infrared images is an added task that you might say you don't want to do. But here's where I said, Shirley, to the dentist, if the dentist could produce $300 to $500 in that 1 hour, okay, let's just do $450. And it's billable through cross-coding, which we know it is. I already know it is. I've spoken with dental writer people and cross-coding people. They actually showed me the CDD codes. So, okay, so it's billable. Why not offer the dental hygienist $125 in that hour or 150 out of that 500? because she's going to take the images and do the report using DrLinxs, and then once it's then the provider link is there for the login of the dentist or the chiropractors, mainly out of office. And now you have more information for creating a treatment that's customized for each patient according to their neurological findings. And it could be something simple as the dentist taking the neurological compression off of a tooth in the occlusion and readjusting the palate a little bit, and now the person's depression is gone, or they're sleeping better. And wouldn't that be great? Now they're going to come back for more, and they're going to trust you as a provider to be long-term. What you want is long-term relationships, and you want referrals from their family and friends. And then you start having repeat business. So, and it's maintenance, because then they'll come into the dental hygiene department saying, I'm here for my rescans. I want to compare. It's been a few months. I want to make sure my nerves are healthy. Sure, no problem. There's no radiation. I'm 3 months pregnant. No problem. They're safe. There's no radiation. Sit in the chair. Make sure you're good to go for this little infant growing inside you, that your neurological findings are safe. So, to me, I see the potential for us to teach these practices how to set up what I call safe kiss cleanings or safe kiss visits. It's going to happen. It's a matter of when. Infrared's not going away.
So I created the files and the folders. So I created 2 folders, one for the chiropractor and one for me. So this is
what you would do is open up your image, click on the image. And so now you want to click on edit to the far right. And so now we can adjust the contrast. And below you have the contrast below where the 2 dots are. Yeah, I put the hand in the middle between both of them and slide it to the left and to the right. So slide it to the left a little bit. Yeah, there you go. Slide it to the right. Okay, there. A little bit more. Yeah, now you're getting some more contrast. Then I'll take okay, so now we got some black background. And now what I'll do is I'll take the right ball to the right of the hand and move it around just so I get there you go. You want to not do too, you see how your image on the temperature bar, you want it kind of in the middle. Yeah, there you go, right there. Boom, right there.
Right here?
Yeah, because what you want to see, you want to get some denotation in the image file too. Just go to the right ball again and just get a little bit isolated, areas of stress.
So this took away the white spot for what I was assuming was the tooth.
Actually, it's there. You just, what you're going to do is just get a little bit more contrast. I see the white spot.
This way it comes back.
Yeah. There you go.
This way it kind of disappears.
The goal is to keep the temperature bar to the far right, where you have equal amount of temperature on the top and the bottom, so that you're looking at the normal temperature in the middle. So, and I was trained by a veterinarian about how to equilibrate this. I wasn't using this tool, and the veterinarian came and boom, sat down, used the tool, and he found it. He isolated it, right? By using this tool. Yeah, right there. See? So now, and so you've got it circled where the white hotspot, but now you isolated it a little more. You can click on the upper left area where it says FLIR, and there's a spot to the left, right there, to the right of that. Yeah, click on that little spot, and now you click on spot, and now you can highlight wherever you want to go. I usually do, most I do is 3 because it sometimes interferes with the image.
Right.
And then you can also use the different tools to highlight with cropping and things. But
can I get rid of this spot? Oh, I can move it. Oh, yeah. Nice.
And you can also right click and delete it.
Okay. So what did I just do?
You moved it.
Okay, but what happened now that I moved it?
I have no idea. Can you move your
Okay.
mouse? So what are you trying to do? Oh,
Well, I don't know what to
you put
circle.
this,
So
you
our
used it.
interest was this tooth,
Yes,
and this showed up as also a problem. And then this happens a lot where this part of the face is kind of this green color. So,
that's parotid. That's the
okay,
parotid glands. I would say that when you use the spot, you used it on the camera software, which is this, this is the editing software.
right.
So you would just highlight that you want to get rid of it or you want to keep it.
I don't know. What am I trying to do right here?
Highlight areas for the doctors to review.
Okay, so this is not necessary to review.
So you just highlight it and delete it.
And just hit delete, and there we go. Okay, so this one here, and then I can write a note here. Will this come through on
I
the
wouldn't put anything.
DrLinxs?
No, it does not.
Okay, all
Just
right, then
leave
never
it,
mind.
the whole goal right here, and then you want to save and exit to
There's
the far
exit.
right.
Oh, there we go.
Yeah. Now you've got an image that you'll upload, that you'll go back to your chiropractic file and you could also, well, if you want to save a step, then you would download it here.
Okay,
Because now you would image, yeah, right. And so you would just take it from the download file and put it into DrLinxs. That's it.
okay. So I would go here, go here.
So it's in your download file folder, I mean.
Right, yep. And I'm just trying to see where the heck it went.
Download folder?
There it is. Oh my God.
Um,
Huh.
yeah, I mean, to get the
It's empty.
contrast,
It
you
didn't
have,
go in there.
yeah,
So
just
let's
drag
see.
it from the download folder into DrLinxs.
Oh,
And with the open library, like there in zone 1, so you have it. Mhm.
it went into the camera. It didn't go into my download folder.
Um, are you in the camera folder? Or are you in the download folder? It looks
This
like
is the camera folder.
yeah,
So,
you can be in the download folder.
well, it wasn't in there. It's in here. It's in the camera folder. That's really weird. Okay, so,
Well, then you can even drag it over from there.
right. Um,
Now I would replace it with the older image. So just grab to the new one
there
and
it
put
is.
and overlay it. Yeah.
It was this one. Do I have to get rid of this one or do
No,
I
you
just go
just
like
grab
that?
it and overlay it. Yeah,
Okay,
that's it.
sweet. Okay. So now it's this one. It has a black background so you can tell right away.
Yeah, I talk about the contrast. It was funny. I was talking with a thermographer one time and they said, contrast? It is a contrast.
Yeah.
I learned it from a veterinarian. Veterinarians get trained on infrared in their college training, how to use this as a diagnostic tool for the animals. It's really well used in racehorsing industry, bar none. It's a multi-gajillion dollar business and they use infrared on these horses.
Okay, so you're thinking that this is easier to see on here.
Well, you line up the girl in the ear. You were talking about that. So
Mm-hmm.
I always go to the girl to get my markings and
Right. And
eyes. Okay, so her neck looks a little off. You see how it's a little forward? And I would enlarge the infrared image a little larger too. There you go. Yeah. Make it almost the same size, And the reason is we want to get those markers, some way. There you go. Yeah. Yeah. A little bit, get that chin lined up a little bit as best you can. Because these are markers, yeah, and that's good. I mean, it's not gonna be perfect because,
right.
and then we take the heat down all the way. Um, and take it, zero it out. And now go to your neurology, the bottom. Now there you go. No, you know what? Go back to the teeth. This would be kind of fun. Keep up
Yeah,
till
because I found that at one point and then I couldn't find it again because there
yeah,
was a
you just
tongue
keep
and
going.
everything.
Yeah, keep going up till you get to the teeth. There they are. Uh-huh. See, there's the bite. We're going to work with Zygote on refining this technique, but I like it enlarged so you can see, but yeah, you can even go closer. You can,
So,
I mean, look at that right there. Can you see that nerve highlighted?
yeah, you can really tell now. So
Yeah.
this is an artery right here, and then right
Uh-huh.
back here, I think, is where the nerve is.
Uh-huh.
So, and so now this is the parotid,
Right. But what you want to do is get to the neurology of it,
right?
and
So
that's
now I can see. So
and you
that
might
was
want to
tooth
look at
number
the
two.
muscle. Look at the muscles that are contracting in the back of her neck and putting that pressure on the C1 atlas, like where she was locked up. Yeah. And then increase the heat and see what's going on, the stress. There you go. Boom.
Crazy.
She's also putting a lot of stress on her arteries. You know that. She's got a lot of stress in her circulation. Do you palpate her neck? And you do extra oral. That's
Yeah,
also
doctor did that. I just took her pictures. I said, stand here.
good for you.
So yeah,
Does she get headaches? Looks like she does.
it looks like she does. Yeah.
Mm-hmm. That's all poor circulation.
Okay.
One of the things I thought was fascinating in speaking with peers is they don't make the correlation of the circulation inside the nerve in the tooth to the brain.
Okay, so this I made good use of. So that's the lingual nerve. I didn't want that one. Was the little pin.
Mm-hmm.
And then I can go back over here and then I can get a bone
Mm-hmm.
and then highlight this bone here,
That's the
atlas,
atlas. Mm-hmm.
and then go like that. And then I can do this and then kind of put a story together.
Yes, exactly, Shirley. That's exactly what we're doing is putting the story together. Exactly right. Yeah.
And then this is the temperature of this white spot.
Uh-huh.
So if the body is 98.6, these are cooler than that, but her body temperature is down here. So her body temperature is cool. So that might be a good thing to do, is just to do a generic spot on okay, I'm talking and I'm making sense to myself, but I'm not making sense to anybody else. Okay, so we
I
made a
think
lot
you
of,
are, Shirley. No, I really do. I mean, what you're doing is you're investigating.
yeah,
So this investigation takes time. And
yes.
where in the healthcare industry do they take this much time?
Well, they
Using,
don't.
using the oral and using the anatomy education we have. So they don't. So we're it. And
Yep,
that's exciting because dental hygienists, I mean, if you're a dental hygienist and you were said, we'd like you to do these investigative reports, we're going to train you and learn, and you'll learn how to take them and you'll be paid $120, $150 for that hour. I think I would do it. I think I would learn it, and I would
yeah,
add about $1,000 to $2,000 a year or a month to my salary. Not scaling and root planing,
Yes.
using my mind. I said it's time to get out of the mouth and into the mind. Do you
So
like that?
this is the,
Oh,
yes, exactly, because our industry right now is under attack, according to the way that the hygienists are reading it, in that our skill set that we learned in the first 2 weeks of our first semester has been co-opted by dental assistants who have zero education. And it's the least important thing that we do. And so hygienists are like completely wigging out over all of this stuff. And I'm like, dude, wake up. This is an opportunity. This is not
We
it's an
built, yes,
opportunity.
yes. Yes, but you know what? We just got to get out there and do it now. We're doing it now with these podcasts.
Yes. Okay. So here we go. So this is the back of his head. This is the person I was telling you about
Sure.
earlier. So,
Okay.
and I did talk with doctor. So she took these and I was like, the kids need to be more square. Um, so he's at a little bit of an angle, but you can see how bright white this spot is here.
Even just on the digital, you can see,
Well, that could be light
not
because there
compared to
was
the right ear.
more light coming in from this side. And
Right.
then this ear is, but it's not like this one. And when you look at his other pictures, even in, this is this side. So that's the side that's so bright white, and this is the other side.
Yeah, she needs
So
to zoom in and get that. He's at an oblique angle, but that's okay. We can work with it.
yeah, so we need to, I don't know, we just got to get better at taking the pictures. So this is the side by side.
Mm-hmm.
And so again, his shoulders aren't square. And when I said square, she's like, what are you talking about? So blah, blah. Okay, so now let me go back to how it was here. This is the upload library. Then you went into the FLIR library and then into the chiropractic. So I have to get his picture in here. So what I did behind the scenes a few minutes ago was I uploaded from his primary folder. And so that is, how else do I get it in here? Is there a way to get it from the DrLinxs or no?
No, it's going to be into the FLIR software folder.
Okay.
You download it from the camera in the DCIM, I believe it's called. I always say DCIM, DMIC. It's the portal there, the folder. It goes
Yes.
camera into the download folder.
So I already took all the pictures off the camera, and they are in my folder that I share with her.
So you'll upload here, upload into the FLIR software from that folder, the camera folder.
So there's the one. There's two. Okay, so it's this one here. Can I rename from here?
Uh-huh.
Okay, so then you said go to edit.
Mm-hmm.
And then you said move this around.
So you get to the black, black contrast. You move it to the right. There you go. And then you just kind of get that there. And then you want to move the right ball so that you get the equal, I would move it to the left a little bit. So you see how the bar, yeah, you want the at normal temperature in the middle. Okay, there you go. Now you can see how his ear is, it's got some issues.
Still hot.
There's more to do with this to show the outline of the child, what's called MSX, but it shows, the outline of the eyes and the ear. That was in the MSX.
Tell me where that is.
It's you want to go right back to where you were before. Cancel, yeah, to the little two squares at the top.
The little two squares at the top.
In the dash.
Here?
Yeah,
Oh, this one. Oh, okay.
no, not there. To the far right. Keep going.
This temperature one?
To the left, to two, like they look like
Oh,
little
there we go. This one?
in MSX. You click on MSX, yeah. Okay, so then you would take at the top where it says MSX and then just kind of go back and you almost have to, that's going to define it. Grab the little square next to MSX and click on it. Next to it, to the far left. Yeah, right there, click on it. Now you're going to have a little box to work with it. And so
Oh,
that box that pops up is a little out of the place, but just go to that square and then you'll shrink it, that white spot, the white square, shrink it down. So there you go, till it matches the infrared, you know. And you can set
oh, I see. Oh, so his head is so gigantic and now,
the camera to take this automatically in your dashboard settings. So this is just an added step that wasn't set in the camera.
oh, okay. So you'll show me how to do, oh, see, now we can really see the ear.
Yeah. And that, and a lot of doctors like that because these are markers. You just click on them, yeah. So now you can see the marking in the anatomy and it's great for the doctors, yeah. See, I'm
So
just
I'm
building
dot
space here
here.
for review.
Say
And
that again?
what's that? I'm building the case for the story. I'm building the
Yes, right.
story. Now look at, I want you to take a drone view right now. Do you see a pattern of trigeminal nerve damage?
I would imagine that this is part of the trigeminal nerve. Yeah.
Look into the forehead.
Yeah.
Look into the orbital. The trigeminal goes into the orbital, the nasal, and the oral cavity. So it's got 3 branches.
Mhm.
So his trigeminal is in trouble. It's damaged. Why? Why is his trigeminal nerve damaging or is damaged? And it's screaming right now for, help me. I'm suffocating.
Yeah.
Happened in the birth canal? We don't know. What happened? Did he fall out of his crib when he was 6 months old? So what we're going to see are symptoms in uh, uh, in his story. These are symptoms. They're not causes. The cause is in the story and the fact finding. Yeah, when he crawled out of his crib when he was 6 months old and landed on his head. And he seemed to be okay. And I, cried a little bit and I gave him some milk. No, you actually torqued his neck. Not you did, but he torqued his neck.
Right. His
So
neck got torqued. Yeah.
as the body grows and ages, it's going to try to adjust the circulation. And when you see something like this, Shirley, I want you to always think jammed circulation. It's jammed
Okay.
and it's a neurological jam.
So this spot right here, the doctor said that when she touches here, he tells her to stop because it hurts.
Yeah.
So there's no suture here. So something else is cooking here.
Well, let's see the contrast and see what's going on from the neck.
Okay.
So you just down at the bottom, the 2 balls down below.
Oh, right. I didn't do that yet.
Yeah, and just get the black background to the right, move it to the right. There you go. Now you got it. Now move the right ball and get some more refinement there. Just a little, so you get some demarcations in the reading.
How's that?
Yeah, that's about right. You're right. There you go. So he's got a lot of trigeminal nerve damage. So what is causing that trigeminal nerve damage? We don't know yet until we do more investigation. And he's got, if you when you take something like this and you put the ligaments over and the muscles and the nerves,
Yeah.
The atlas, you'll say, holy moly. Then you investigate with the mom, say, oh, well, if she says nothing happened and he's been fine, she's lying. Something
Or
happened.
she forgot. I mean, they're not always lying. But if you have more than one kid, it's so easy to forget stuff. Okay, so I'm going to download this one. So the thermal image. So what if I chose digital image?
Oh, then you would see the actual, you can choose digital to download. I would download digital. I
Okay,
like to do the digital and compare side by side and overlay in the view for the doctors. I also is helpful. It's an actual digital image with the thermal, and you can overlay them, and they're perfectly lined because it's the same image.
Okay, so okay, and then I'm going to download the thermal image, right?
You've downloaded the thermal, then the digital is just a photograph.
Okay. Okay, and then so this one, I have a sneeze coming. Woo!
Bless you.
Let's do this. Okay, so now here, okay. So then they'll line up perfectly. Okay.
Yeah. It's, you know,
So where's the third one that I just put in here? Well, let's just call it done for right now. So this is not the new one. Where's the new one?
I don't see that you clicked on it.
No, they're not. They did not land up in my little folder here. So what happened?
And you can look at the numbers too, you know?
Yeah, well, I changed the name is what to make
Oh,
it easier.
okay.
Okay, so now they're not even in here anymore. So they're in no man's land.
Or in another folder. I mean, I don't know. If you didn't download it, it's gonna still be, I mean, you downloading out of the FLIR folders, they're still there, so.
Oh, let's see what happened. There we go. So now I can go like this, go like this, oopie, go side by side,
And you can
and then overlay, and they match up better.
yes. You can, yeah, you can refine the sizes there. And then you can even take the temperature to the very far right, like you were doing in the 3D and the zygote. Yeah.
Okay. All
And then,
right, so I
yeah,
can do that,
you can take the
which,
temperature down to the far right on the far right bar. Yeah. That you did.
oh,
Yeah. There you go.
oh, sweet. Oh, geez. Yeah, you did think of everything.
I tried. And then go to the bottom, keep going, lower it, go. Okay. Now, this is where you start to tell your story.
Okay.
And then you bring it up little by little, and you can start to see, you know, where the story, okay. So on his left ear in his or his left side of his skull, he's got some But it's more interesting. I mean, it's apparent on the left, but it looks like the right side has the injury, not the left. The left
Yes.
is the right side has the injury, and the left side is trying to keep him in his head from tilting. So the body does what it compensates. So if you have the injury on the right side, it's going to be painful on the left.
The body is opposite. That's how I always say it.
It's opposite. So that's where you start to look for the story and you start to look for the damage. And in the software, I built it for life damage events so that they have an investigation saying, dang, man, at 3 years old, he hit his head on a coffee table. And like you said, more than one child. And this
Yeah.
is, you jog the memory and you use infrared to say, did anything happen to the kid when he was, what was the birth like? I mean, there's so many, questions that you can use for investigation to get to the bottom. So what we're looking at is the frontal. I would get the person, get the main character. Yeah, there you go. And get your bearings. Uh-huh. And then you can always pull it up like you can. You can.
This part is hard. I don't know why I can't move it up because I've been moving it up this whole time.
Well, your screen is you're not max. I like to maximize my screen. Your screen view.
This is maximum. I don't know what you mean.
Right.
I just have a couple of tabs. Mostly this is as big as it gets.
Um, I'm not sure. I usually
Oh,
can.
there we go.
Yeah, I
It's
don't.
just a little tricky.
You got to just put some pressure on it. That's all.
Okay, so then make this be,
You can always use your up and down navigation to the left too.
oh, I guess I didn't think about that. So I'm interested in that here.
You'll probably have to pull the body down just a little bit. There you go. Yes. And you can increase the zygote, the persons to match the ears. Uh-huh. There you go. Good.
Okay, so now we go down here into nerve land.
All the way to the bottom. That's the nerves. There you go. You can get the spinal cord and the brain tissue. Mhm. Now you got the lymphatics. And there you go. There's the nerves. Mhm. So it looks like if you look at always look at the root, look at his occipital lobe right there. What's going on there, and pull the temperature down. I would pull it all the way down, and click on it. Yeah. That's not really it. Yeah.
Yeah, that's not
What it's saying is outer dura.
right.
Okay. Now go get your heat back or your temperature because this is investigation time that no one else is doing. And now you're pulling up the chemical part of the body, not the nervous system.
Right. So I'm trying to see if we can tell
Look at that, the atlas. Look
if
at the,
the atlas is part of this problem.
I'm sure it is. That's an interesting part. I would heat it right now. Just see, I'm curious. Something's going on there. Yeah. But you've got some compression there. Um, Posterior occipital, yep, occipital membrane. Okay, so is he ADD? Does he have any attention deficit? Is he got
Yeah.
any?
Yeah.
Okay. See, he's got pressure on the brain. And the thing is, before you get out of there, go to Google and say, what's the purpose of this? And then you go to and then it shows you all the purpose, and then you'll say, oh my gosh, this is what the kid's going through. So
Yes. So I think there's also
you,
something happening here, and he might
well,
even have a hemorrhage right
well,
there.
find out. That's a referral source.
Well, yeah.
Okay, then click on the nerve. Look at how it has at the apex of that nerve, that right there. You see how it is? Now click on that circulation on
Okay,
the
explain it again. Because I can't click on here until I turn
you
this
gotta get,
off.
yeah, there you go. Okay, what is it? Occipital.
Occipital vein.
So you're getting a pattern here. You see it? Occipital membrane,
Mhm.
occipital lobe, occipital vein. You're starting to tell a story
Yeah.
that, and
Oh, wait, I'm gonna go here. And then I'm gonna go back down here. So those will be highlighted, and I want to see, there's really not a lot of nerve pattern that goes up into that part.
well, that you can see from the posterior, but from the
Oh,
lateral, you see a ton of it. That's why you take a lateral shot because you can't, this is,
yeah.
yeah.
All right, so we are at an hour, and
Okay.
I think we've covered a lot of stuff already, and we can really kind of promote the training for all of this so that we can spend more time. I don't want to do the whole training on YouTube because you can see every time we do one little movement, there's like 6 questions that show up, and that all needs to be addressed. And that's what happens in the training. Is that right?
It is. And the most important thing is exposure for DrLinxs. They get the exposure and they say, I have a career opportunity here now to
Yeah.
expand my career into investigative.
And how to make money doing it for the practice.
Yes.
So those are the kinds of things that we would be doing during the training. We don't
Shirley,
have a date set yet, but certainly by August, I would imagine we could have something.
I believe so. Well,
Yeah.
I see is really getting the information out to our dental hygiene professionals. I think they're the ones that are going to need the tools to go to the dentist. I thought we would go to the dentist, to the hygienist. It's not going to happen because there's no education in the cranial nerves. So we need a course for the dentist on cranial nerves, Shirley. We just do. And maybe we
Well, you know what? I would put it together with the meridians, with the tooth meridians,
absolutely.
because I think that piece is like completely lost. And I don't remember what the doctor's name was, but he was talking twice now at the Holistic Dental Conference about decay in teeth and its psychological roots. So, like the upper right side was tied to the mother, and the upper left side was tied to the father. So, whatever kind of so they mapped all of this out. So it's really cool. And if you're going to be in any kind of a holistic practice or integrative practice, if you're not looking at the teeth, which is what I think we've never really said, like in a sentence, you are not treating your whole patient. So that's part of what it is that we're trying to get across here.
This is what I said. What if I could show you using DMT infrared imaging how important your eyes are for looking for medical inside your dental domain? So you're in a dental domain looking at medical domain issues,
Yeah.
treating dental, but really you're looking at medical domain. So we are in a dental domain looking at medical domain, and we need to discuss, we need to have that collaboration put into place, and that's going to be what we were just saying, the collaboration investigative report. It's more cost effective for a dental hygienist to do this, not a dental assistant. I love dental assistants, they're wonderful, but we have the nursing training and the foundational education for this next phase in our care of delivery.
We've
And
at least heard the term hypoglossal nerve in the past. You know, it needs to just come back up to the front.
yes, you know what? Let's harvest our training, and we'll harvest our post training and bring it back on the forefront and use it. Mine got buried unless I didn't use it.
Yeah,
Intraoral palpations. I asked a hygienist recently spoke with, and she said, I learned it in school. I said, are you using it? And she said, no.
what for?
What for? I
What
want
for? There's pockets. I have to scrape the pockets. They're still
to.
stuck there. I just can't believe it.
Because you and I are groundbreaking, the putting the education back into putting the mouth into the mind, or putting the mind back into the mouth, or something like that, where, why not use it? Because it's life quality changing for these cases in front of us. I caught, and I'll close with this. I did extraoral palpation on a patient, as I always did, right out of hygiene school, never stopped. And I felt palpated the left side. I said, something's not feeling right. It's a little too stiff. Will you go have this checked at your doctor's office? He did, and they caught an early stroke.
Oh my
And
gosh.
to this day, his wife and him think I walk on water. And I
Yeah.
said, doing my job. Thank you for the compliment, but I'm just doing my job. And they were just so, so grateful. Well, I get goosebumps when I think of the joy that his life has now. And now he knows. Now let add infrared to those investigations and think about that 8 to 10 years before we have a symptom. So let's do it. Let's get
And
our
if you are able to charge out $150 or something, you can sit without a patient and you can still take that hour of time and put this together and create a story for your patient. Will it sell dentistry? Probably.
absolutely.
So you will provide the dental practice with supporting income, and you will build relationships with your referring to doctors. You're going to be needing an ENT, a naturopath, a chiropractor, because some of this stuff needs to be manipulated, some of the stuff needs to be surgically removed, and some of the stuff just needs a vitamin. So that's what that's the collaboration. That's the kaleidoscope that
About
we're
this.
working with.
The medical domain in the mouth, we are the only healthcare, bar none, and I believe dental hygienists, we have over 2,500 hours of investigation we're taught, aren't we? The clinical part was the small part, but most of my education was on investigation and learning the medical domain about it in the dental domain. So I think that's where we're going to go next with enhancing our career options with dental hygiene profession. And quote me on that.
Yeah. All right. So to find out more about primal air and myofunctional therapy and how you can become a myofunctional therapist and work with us to help myofunctional disorders, if you'd like to, that's primalair.com. And then to learn more about DrLinxs software, and we'll be getting the training pages up there pretty soon.
Let me put my 2 cents in. So in order
Yeah.
to get the training and the certification on drlinxs.com, DrLinxs.com, contact me and we'll get you going into the certification level you would like. Remember that it's not just dental domain. We can go
Right.
up to the body and they can become independent contractors as a dental medical hygienist. So the goal is, there's no goal. I mean, there's a goal, but there's no limit.
Right. There you go.
There's no
No
limit.
limit.
So, but yes,